today's video, we're going to talk about Medicare and end-stage renal disease. So if you have end-stage renal disease requiring dialysis, we're going to talk about how Medicare can benefit you, how to apply for Medicare, and your options as well. So if you are newly diagnosed with end-stage renal disease and you are required to have dialysis, you have permanent kidney damage, then this video is for you. You definitely want to watch this video so that way you know the options out there. To get dialysis treatment is very expensive. It could cost you anywhere between $300 to $500 each session, and most individuals have to go 3 times a week. So that cost can really add up. So in today's video, I'm going to help you understand what is Medicare, how you can apply for Medicare, and your options. So what is Medicare? Medicare is for individuals turning 65. It's health insurance for seniors. However, you can also get on Medicare if you have certain disabilities such as dialysis. So if you are newly diagnosed with end-stage renal disease receiving dialysis, then you actually qualify for Medicare, okay? So I'm going to explain to you what are your options and how to enroll and all of that, okay? So dialysis treatment can be extremely expensive. We're talking $300 to $500 per session, and most individuals do have to get treatment 3 times a week, so that can really add up. And a lot of individuals cannot get to dialysis because they're not well enough to drive or whatever the case may be. So transportation may also be an issue, but I'm going to give you guys the solutions to all of that, okay? So let's start with how can you actually apply for Medicare? So you need to contact your local Social Security office. You can call them as well, and I'll leave the number to the Social Security office right here, okay? So you could call the Social Security office or go to your local Social Security office, go ahead and set up an appointment or take a number, have a seat, and start the process, okay? The most important thing that you need to take with you to the Social Security office is proof that you actually have end-stage renal disease and you're receiving dialysis treatments, okay? So what you want to do is go ahead and get the information from your doctor, or the Social Security office will gather that information from your doctor, like your H&P, your history and physical, your treatments from the dialysis center and such. You can also get the social worker to help you with this information as well. So gather your information and go ahead and set up that appointment with your local Social Security office. So some of the documentation you may want to go ahead and take with you at your Social Security appointment to apply for Medicare is your medical history, your laboratory findings, and any documentation that your doctor has that shows that you actually indeed have end-stage renal disease. Alrighty, so let's talk about the parts of Medicare. So you have 2 parts of Medicare. You have Medicare Part A, which is your hospital coverage, and Medicare Part B, which is your medical coverage. It will also help with outpatient dialysis treatments and such. Medicare Part B only covers 80%. So you're left behind with 20%, okay? And you also need a drug plan as well. So when you're first eligible for Medicare, they give you 7 months to go ahead and sign up for Part D, which is your prescription drug coverage. So you're definitely going to want to go ahead and apply for your drug coverage as well, okay? So a quick recap. So you have Medicare Part A, you have Medicare Part B, and you also need a drug plan as well. And this is considered Original Medicare. Now, the good thing about Original Medicare is you can go to any provider that takes Original Medicare. There's no doctor networks. However, you have that 20% that you're responsible for. Now, because of that 20%, you're also going to need a supplement plan as well. Because of your age, you're under the age of 65, a supplement plan would be extremely expensive. You're looking about $700 per month for a Medicare supplement. A supplement can range between $500 to $700 a month because you're under the age of 65. Now let's talk about your second option. You actually have another option, and that is a Medicare Advantage plan. So when you have a Medicare Advantage plan, it's a all-in-one plan, okay? So you're going to have your Part A, which is your hospital coverage, your Part B, which is your medical coverage, which is going to help with your dialysis treatment. And you're also going to have your prescription drug coverage as well. So like I said, it's all in one. So it's going to have Part A, Part B, and your Part D, which is your medications, okay? And it's going to include extra benefits such as dental, vision, hearing, and things like that. And a lot of plans also include transportation, and that will help you get to and from dialysis. So the Medicare Advantage plan may be a better route for your situation. I would highly recommend that you look at Medicare Advantage plans in your area to find you a plan that your dialysis center takes, that your primary care doctor takes, and your specialist doctor takes as well. These plans do require doctor networks. Original Medicare, no doctor network. However, a Medicare Advantage plans do require networks. So you want to make sure all of your doctors are in network, and you want to look at the medications that you take as well. How does that plan actually cover your medication costs? Let's go a little step further here. You can also apply for Medicaid, okay? With Medicaid and Medicare, then most of your copays will be zero depending on the level of Medicaid that you get approved for. So if you can qualify for Medicaid, I highly recommend you go ahead and apply for Medicaid as well. Now, Medicaid is going to be a little different. Medicaid is based on your income. So if your income is low enough, then go ahead and apply for Medicaid as well. So that way you have Medicare and you have Medicaid, and the two together will really help with those extra perks, those extra benefits, and lower copays. Most of the time, your copays will end up being zero when you have both Medicare and Medicaid. And now let's talk about the costs associated with Medicare. Usually, Medicare Part A would be a $0 monthly premium if you have enough working credits. Now, Medicare Part B does have a monthly premium. Most individuals will pay the monthly premium of $174.70. Later on in this video, I'm going to talk about how you can actually get rid of the Part B premium if you qualify for Medicaid. Also, I want you to take note that if you also qualify for Medicaid, Medicaid will pay your Part B premium for you. That is definitely a plus. So if you qualify for Medicaid, I highly recommend that you apply for Medicaid as well. Thank you so much for watching this video. I hope I made it really clear that if you're on dialysis, you're getting treatment, end-stage renal disease, you definitely need to go ahead and apply for Medicare. And if you qualify for Medicaid, definitely apply for Medicaid as well. If you need any assistance, give our office a call. We'll be more than happy to help. Our number is right here. Also, like this video. It will really help the channel out. And if you know anyone that is on dialysis and they don't know about Medicare, share this video with them. Thank you so much for watching, and I'll see you on the next video. Bye!